Young children tend to spread germs easily because they don't know proper hygiene techniques. Toys get put in their mouth, children pick their nose, they touch their mouth, and then they grab toys and each other, and then children in your care, they get sick. So in this age of COVID and other transmissible diseases, how can you prevent the transmission of childhood illnesses? I'm Maria George, and as a parent, a health educator, and a child development instructor, I'm here to help you answer that question. In order to understand how to prevent transmission, you need to know how diseases are spread. Microbes such as bacteria and viruses can be spread in 5 different ways. The first route is the respiratory route, and these germs are found in the nose, mouth, throat, and upper respiratory system. The common cold and sore throat are 2 common illnesses that are spread in childcare and education settings. These germs are transmitted through sneezing and coughing and are airborne, so other children and adults can easily pick them up. So how can you prevent transferring respiratory illnesses? Well, one method that is specific to this route is to encourage the child and adult to sneeze either into their sleeve or into their elbow. Why? Because if you sneeze into your hand, then that hand is likely to touch other objects or people. The second route is the fecal oral route, and this is when disease-causing organisms that live in our gut get transferred by our hands into our mouths and to the food that we eat or serve. So some examples of these types of diseases include hepatitis A, diarrhea, and hand, foot, and mouth disease, which can be common in children. Sound gross? It is. So as you can probably guess, the best way to prevent transmission of these types of diseases is proper hand washing, especially after using the bathroom. But I'm going to go into a little bit more when I go over universal precautions. The third route is direct contact, and this occurs when children are in close proximity with one another and they touch one another, and they can just get that disease directly from other children. So examples of these types of diseases include conjunctivitis, which is pink eye, or head lice. And so it is quite challenging to prevent these types of transmissions because young children, they do tend to touch each other and then to share toys. The fourth type of transmission route is the bodily fluids, and diseases transmitted through fluids, body fluids such as saliva, blood, and urine. So examples of diseases for this is hepatitis B and hepatitis C, which thankfully is rare in children. The fifth route is the vector-borne route. Vectors are living organisms that can transmit diseases. For example, ticks can transfer Lyme disease. Mosquitoes can transmit dengue fever and malaria. Mice and rats can transfer trichinosis, and other animals and insects can also be carriers. But these are more uncommon. It depends on where you live and the season that you're in. So which of these are you familiar with? Let me know in the comments below which of these methods that you've heard of and what you would do to prevent transmission of these types of diseases. So now that you know how diseases are spread, how can we prevent them, especially in young children? There are 5 main things that we can do to control the spread of illnesses. As I mentioned before with the fecal oral route, proper hand washing is essential. Make sure that children wash their hands after using the bathroom and before eating. Help the child if needed. Have them sing the ABCs. Sing the ABCs for them. Make sure they use soap, because as a teacher, I've seen kids just try to rinse their hands, but no, they need soap and they need to rub their hands together to get those germs out. And staff need to wash their hands too, especially after changing diapers and touching bodily fluids before food prepping and before eating. A second thing that you could do is to wear disposable gloves when changing diapers or helping children in the bathroom, or when you need to come in contact with bodily fluids, such as if the child has a cut or a scrape or a rash. And then knowing how to properly remove the gloves and dispose of them, and then washing your hands after removing them. The third thing that you should do is clean, sanitize, and disinfect. So clean objects such as toys that you see children touch with their dirty hands or put into their mouths, and clean surfaces, bathroom surfaces, kitchen surfaces, tabletops. Now that we've gone through COVID, we know how contagious germs can be, so we can never be too careful. The fourth thing you should do is waste disposal. Properly dispose of waste materials to prevent the spread of disease, odors, and pests. And then make sure that the waste containers that you use are lined with plastic bags that are waterproof and pest proof. A fifth thing that you could do is proper diaper changing procedures. I'm not going to go into the details here because there are a lot of steps, but if you're working in a center and you need to change diapers, make sure that the procedures are clearly posted and staff are following them. The last thing that I wanted to mention is vaccinations. I just wanted to mention that here because it can be an effective tool. I know that people have different thoughts on this subject, and so I'm not going to go into details, but just know that you can provide information for families that you serve, and then also talk to your doctor, have families talk to their doctor, get good information, and then just help them to make good decisions in this area. So I hope that this video helped you have a good general overview of some common illnesses in children, how diseases spread, and what you can do to prevent them as a parent, a caregiver, or someone who works with children. In the comments below, let me know how it helped you. And then if you want to share any tips on disease prevention for young children, let me know that too. And then if this video has helped you, hit that like button. And then subscribe for future content on how to apply child development concepts. Then watch these next videos to learn more and get more information about health and children. And thank you for watching.